you ready to turn the link on, and then we're gonna just have welcome
Alexa,
Sharp.
stop.
We'll have Reverend Sharp. Let's
Hey,
go,
Rev.
Reverend. We're gonna get started. Everyone's on, and all our participants. We're gonna turn it over to you, Reverend Sharpton. You have to turn off your mute, Rev.
All right, there we go.
Here we go, sir.
All right, let me begin. I'm Reverend Al Sharpton, president of National Action Network, and I'll be hosting tonight Healthcare Equality Network. This is a vital issue in our community as we are dealing with issues of criminal justice and policing. We are in the middle of a pandemic, and dealing with health services, dealing with healthcare equality is a vital issue and a primary concern in our community. So Healthcare Equality Network has put together this group of leaders and thinkers in our community to address it from different vantage points, because as we have this moment of social mobility, it would be blasphemous in my judgment if we did not also deal with how we want to bring more equality and fairness at every level of health services, and those that are benefiting and those that are not, particularly in our community. So as we listen to these leaders and thinkers, it is toward trying to have a united goal of how we deal with this issue and how we execute a plan that will, in fact, change the imbalance in healthcare services as it relates to communities of color, Black people, and depressed areas. So we're going to start by me bringing on Elroy Saylor, who will bring on some of our team of leadership. Elroy, thank you for bringing us together.
Reverend Sharpton, thank you for your spirit and your heart. To our participants, I'm sure everyone had a chance to see the Rev give such an amazing sermon and just a testament to who we are as human beings and humanity a few weeks ago at the funeral. And I just wanted to again publicly let the Rev know that I'm sure I speak for everyone on the phone that was just a spirit-felt sermon. And if God hadn't put that on your heart to give it, we would have had to send some prayers up, because we needed to hear that as a country and as a nation and as a world, I would say. But thank you all.
I want to thank Dr. Chavez for letting me use his notes.
Well, Dr. Chavez will have a chance to respond. Well, I want to thank all of our participants for joining us. We're a few minutes late, and that's uncanny. We typically like to start on time, but in this new age of Zoom and Microsoft Teams, we're still trying to figure it out, so bear with us. We're going to get everyone back to dinner by 7 o'clock, 7:05 at the latest. We started this effort back in February during Black History Month with Reverend Al Sharpton in South Carolina, right before the Democrat primary there. And we had a packed house where we talked about many of the health issues, the disparities that plague our nation, as we are looking at unprecedented times with COVID, prison reform, unemployment, vacancies, businesses going out. We are clearly seeing and continue to see the disparities that impact our communities and Black folks in general. So one of the things that we wanted to do when we started out back in February, and it was very clear, we said that with Reverend Sharpton's leadership, we wanted to make sure that healthcare stayed front and center to our discussion. So we're here 4 months later. We've had several op-eds. We've launched a campaign with several of the leaders that you'll hear from secondly, and we're going to try to continue this campaign of ensuring that healthcare stays front and center throughout the rest of the year. But I'm going to be quiet, and I'm going to introduce our leaders of the campaign, the Healthcare Quality Network. You can go to the website and check it out. You can also follow us on Twitter at health_equality, and then on Facebook at Health Equality Network, and then you can also look at the website at Health Equality Network. Let me start with introducing Linda Blunt with the Black Women's Health Imperative. We'll give Linda a few minutes to talk a little bit about her organization.
Linda, before we go to Linda, I see Congresswoman Robin Kelly has joined us. The chairperson of the Congressional Black Caucus couldn't be here, but Congresswoman Kelly if you don't mind, Linda, has been on point for the caucus and really in the Congress on these issues. And in the meeting that we had, the well-attended meeting in South Carolina, we wanted always public officials to really weigh in on this because they will help guide it on the legislative side. We need to know what is on the agenda, what they're moving toward, and what the facts are as they see it. We were fortunate in the South Carolina meeting to have everyone from all of the presidential candidates who were running in the primary at the time. Then we had former Vice President Biden, we had Bernie Sanders, we had Klobuchar. All of the candidates came and addressed the body. So it's in that spirit we want to open tonight with the Congresswoman from Illinois, Chicago to be exact, Congresswoman Robin Kelly.
Am I unmuted?
Yeah, you're unmuted.
Oh, okay.
You know we can't mute you.
I don't want to say the wrong thing. Thank you, Reverend Sharpton. I want to thank you for your leadership and your unwavering commitment to reduce health disparities in America. I am Robin Kelly. I represent the 2nd Congressional District of Illinois. And the chair of the caucus asked me, could I come on tonight? I'm the chair of the Congressional Black Caucus Health Braintrust. And just for my part of the conversation, I'm going to give you a quick update. I'm in between votes. So I want to give you an overview of the state of play right now and what we're working to get done. And that you all know, tragically, what COVID-19 has done in Chicago. Initially, 72% of the people dying were African-American, and now more African-Americans are dying, but more Latinx have the disease. And a lot of that, as you know, are because of the social determinants of health. We like to say because we're that or a heart disease or this, that, and the other, but there's reasons, you know, that we're obese and we have heart disease, diabetes, and those kind of things. And we like to talk about the CBC, the social determinants of health, about, you know, all the gaps, the wealth gap, the job gap, the education gap, and of course the health gap, rather than talking about the victims. So this disease has really pointed out all the gaps and that we have a two-tiered system in America. So some of the things that we did, we worked on with the CDC and NIH about the big gap in racial disparities. They were supposed to, back from when AIDS legislation passed, they were supposed to have racial data. They were woefully inadequate. So working with Senator Warren in the Senate and myself, Ayanna Presley, Barbara Lee, Karen Bass, we got racial disparities put into the CARES Act, where the CDC had to collect data from every state. Well, initially it was 9 states, then 14 states, and then it moved up and up and up. But the report that they put out was horrible. I mean, it was 3 or 4 pages of nothing but links. So needless to say, we have met with Dr. Redfield again and again, and he promises, along with Admiral Garrar, you know, that the next reports will be very different. We just need to see what we could do to help them get the information, because some of the states haven't even started to make any changes. They don't have the technology to really collect the data. So we're working with them to see what we can do to make sure we get the information, because as you know, the information informs policy, you know, program, and where the resources go. And in the HEROES Act, we got $75 billion. So CBC has really led in this, you know, for more testing and for mobile testing, because we always expect people to come to us, and we need to go to where the people are, whether it's into the neighborhoods, whether it's to the post office where we work, or the grocery store, or to, like in Chicago, the Chicago Transit Authority, where the people are that are working. But naturally, Mitch McConnell has not cooperated, and he has not called that bill, but we're still, you know, pushing, you know, for that. And then Senator Booker and I have a bill, the Community Solutions to COVID-19, because what we want to do, we want to have grants so the money goes right back into the neighborhoods. I mean, it's us that's sick, and we want to be part of the solution. Again, not just the people getting sick, but we want to fix the sick. And in my district, one place in my district is one of the worst in the city of Chicago, and they already have community healthcare workers. So we want to see more of that, more community healthcare workers that can actually go into the neighborhoods and talk to the people. So we have a grant that we've proposed that neighborhood organizations will get. The other thing we're working on is telemedicine, because we feel like if done right, telemedicine could be the great equalizer in healthcare. And we've spoken to Black doctors across the country, and what they're finding is that people are keeping their appointments more because they don't have to take 2 buses to get there. They don't have to find childcare. And so it's been a positive. And you know, the regulations have been waived right now. So we're looking at, some people are looking at, if we can get this legislation passed, keep the waivers like they are. You know, when the pandemic is over or the public health crisis is over, we're looking at a study, but we'll take the more aggressive bill if that is, you know, if that's what comes first. And the other thing going on, Nancy Pelosi put in the Affordable Care Act enhancement bill. So one thing about that bill is that it includes legislation that I've been working on as far as maternal mortality, so that Linda, believe it or not, that we'll get the Medicaid extended to a year instead of just 2 months after pregnancy, which everyone agrees that is the first step in cutting down maternal mortality. 700 women die a year. Black women die 3 to 4 times the rate. In Chicago is 6 times the rate. In the state of Washington, Native women die at 8 times the rate. New York, Black women, I think it's like 10 times the rate, you know, something to that effect. So we're, you know, hoping again that, you know, we could get this bill called in the Senate. But the bottom line is, we tell everybody, if we can't get these bills called, that makes November so very important, because we have a lot of good stuff in the hopper. And the other thing we're pushing is fill out the census, fill out the census, fill out the census. But I think that's it. That was really quick, but overview.
Well, thank you. Go ahead, Reverend.
I was going to say thank you to the Congresswoman. Give it back to you, Elroy, to bring Linda on.
Thank you so much, Congresswoman. How long do you have with us, Congresswoman? Because I want to be mindful of your time, and I want to let some of our participants ask you some questions as well.
Probably like 10 minutes, maybe. I just ran and voted, so when they call the next vote, I just have to run. And there's still a few people that haven't voted, so okay, I can wait maybe 10 to 15 minutes, something like that, maybe a little bit.
Why don't we do this? Why don't we do, I'm going to change the program a little around, if that's okay, Reverend Sharpton. Let's do 2 introductions and overviews of part of our leadership team, and then let's jump into at least 2 or 3 questions, because I know there's 50 of our leaders from many of our chapter presidents from around the country to just grassroots leaders that are going to want to hear from you and ask you a question before you leave.
All right.
So we're going to just turn it back over to Dr. Blunt. I called her Dr. Blunt yesterday. She said she wasn't a PhD. I said, that's for a PhD. So Dr. Blunt.
Thank you, Elroy, very much. And thank you, Reverend Sharpton, for your leadership, for your work to get to health equity. And of course, I am Congresswoman Robin Kelly's #1 fan. I'm the president of the fan club. So thank you so much for your work, and to the Healthcare Equality Network. I'll be very brief. I'm with the Black Women's Health Imperative, and we are the only national organization focused on Black women's health, and have been for more than 37 years. And so today I just want to talk about sort of what's happened. A lot's happened in the last 16 weeks. Some of you will remember way back in early March that some people thought Black people couldn't get COVID-19. We have learned so much. Not only are Black people at greater risk for COVID-19 infections and death, we now know the estimates are off by as much as 50%, and that's consistent with some of the work that the BWHI did in early March when we looked at disparities. And we know in certain cities, as the Congresswoman said, Black women are 2, 3, maybe, Black people are 2, 3, maybe 7 times as likely to die from COVID-19. And they talk about the social determinants of health and these underlying causes, but we know the systems that lead to these underlying causes. There's no biologic or genetic reason why Black people should get COVID-19 more or die from it more. And way back when, we also thought that pregnant women were at low risk for COVID-19, and now we know that's not true either. According to the CDC, pregnant women with COVID-19 are more likely to be hospitalized and put on a ventilator than non-pregnant women, and Black pregnant women are at even higher risk. Since March, Black people are 50% more likely to have lost a job, a third less likely to be able to work from home. They make up 70% of city subway riders, and they're 4 times more likely to work customer-facing jobs, often at the mercy of unmasked and angry customers, as we've seen. And when we look at COVID-19, testing is supposed to be without copay, but some people have paid as much as $987 for a test. And the pregnant woman who's suddenly short of breath finds herself admitted to a hospital that's not in her network. She could face as much as a $40,000 bill should she survive. And so now the bills are coming due. Hospitals and physicians who treated COVID-19 patients want their money. Insurance companies often want to pay less and less. So we think about the grandmother who's just out of rehab, or the new mom with a 3-month-old baby. They're left with a bill, a huge surprise. And they shouldn't have to pay. So as the CEO of the only national organization focused on Black women's health, I'm really concerned. We need a good faith effort from Congress to pass meaningful legislation that protects patients from financial ruin and holds insurers accountable. We need legislation that ensures that patients are held harmless from surprise bills. And we must have protection against rising premiums for all types of health plans in all types of healthcare settings. Unfortunately, this pandemic took our country by surprise. And as a result, Black people faced terrible surprises as well: loss of jobs and loss of too many family members. We've been talking about ending surprise medical billing for a long time and creating health equity well before COVID-19. So it's time now. Let's not add another terrible surprise to Black patients. So thank you for this opportunity.
Well, thank you, Dr. Blunt, for joining this coalition. And Congresswoman, as you may be aware, we started this effort back in February, right before the Democratic primary, with Reverend Sharpton hosting a little over 100 people there and speaking with just about anybody and everybody that could listen. We formed this coalition of key civil rights, economics, human rights, center-left and center-right organizations that care about the health of our folks. I'm going to jump over to Dr. Ben Chavis, who's been on the forefront, and I'm sure you and Dr. Chavis have got a long-standing relationship, so I don't need to introduce him. But Dr. Chavis, why don't you take a few minutes, and then after your comments, Dr. Chavis, we're going to allow the audience to ask a few questions before the Congresswoman has to go back and finish doing the people's business there. You got to come off mute, Doc. You're on mute.
I just unmuted myself. Thank you very much. There you go,
sir. Thank you.
First, I want to thank you, Elwa, for your leadership in pulling this coalition together. I want to thank the Reverend Al Sharpton, who's hosting this webinar, and I want to personally thank him for his leadership, for his courage, and the sermon that he gave at the memorial service for George Floyd was a sermon of the century. And in terms of the eulogy, but also getting us to see that we must challenge systemic racism in all of its manifestations. And of course, when it comes to health disparities, Congresswoman Kelly, we thank you for your leadership in the Congressional Black Caucus and all the members of the caucus who will champion this issue. Some of you may have seen I wrote an op-ed about this issue yesterday that's been posted widely. We need to do more because our Black people are really being injured by these surprise medical bills. First of all, you know, they deny us almost health care outside of the hospital. Then when they get us in the hospital, we're literally economically taken advantage of, just trying to get well and health. So on behalf of the National Newspaper Publishers Association, I'll be very brief. You can count on our 230 African-American owned newspapers. We reach about 20 million people a week in print. Now we're in digital, we reach more than that. So we're going to be with this coalition all the way through. I think there are members of Congress that are riding the fence on this. We need to push them. Some of these big insurance companies are taking advantage of our people. And I think if there was ever a time to call out racism, it is now. The flags are coming down, the statues are coming down, but now we got to get some of these public policies to come down. We need corporate America to step up and sometimes be challenged to treat African Americans and other people of color more fairly. So God bless this coalition. We're in 100%.
Thank you so much, Dr. Chavis. And your op-ed, if you all have not seen his op-ed that appeared today, Congresswoman, we'll have to send you a copy of it. It was a very succinct, well thought out opinion editorial on the issues affecting our community. Maggie, if we can you queue us up to get a few questions for the Congresswoman before she departs? So if you have a question, I see we have about 51 participants, which is what we wanted. Just raise your hand now. Be aware, I'm just getting off the typewriter, so all this stuff is a little new to me. Let's see here. Guys, so the participants, if you want to just go into the, I guess it's called the queue. Go into the queue and click that little hand and pop on it, and you can, Maggie will then allow you to ask your question. If we don't have any questions for the Congresswoman right now, then we will jump right into the rest of our speakers.
There was just one more thing I wanted to say. I forgot to mention, you know, I'm on Energy and Commerce, and along with Congresswoman Yvette Clarke, we talked to the chairman about letting us start out of Energy and Commerce a task force on racial disparities. We were just looking at health, but he has challenged us to do health, energy, communication and technology, and there's one more, the environment. I think that's the other one that we're going to start to take a look at and dismantle.
Okay, thank you, Congresswoman. The first question looks like it's from LaToya.
Yes, hi, can you all hear me?
We sure can. Go right ahead, LaToya.
This is LaToya Congola, representing the Frederick Douglass Foundation of Maryland. I hear you all talking about health disparities. However, I'm not hearing anyone addressing mental health. And as a mental health provider, I can tell you that our white counterparts are generations ahead of us. African Americans are at higher risk for chronic illness and mental health disparities or issues related to generational trauma, adverse childhood experiences. When you talk about African Americans and obesity, I think I heard someone mention African American and women in obesity. When we spell stress backwards, it's desserts. Okay, so and I'm being honest with you, because those are the ways that depression manifests itself in African American women, is in anger and obesity. So I want us to really look at what we can do to really address the issues related to mental health, to generational trauma when it comes to our people, because that's where we are behind and we are being damaged when it comes to mental health. So what are your thoughts on that?
You know what? I just came out of a 4 or 5 hour hearing today, and the name of the hearing on Energy and Commerce, High Anxiety and Stress, Legislation to Improve Mental Health. So we just talked about this all day, and we have 4 witnesses talk to us about the very issues that you're talking about. So no, I totally agree with you. There's about 22 bills, and believe it or not, they're bipartisan, which means that, you know, we can get them out the House and they'll have a better chance of passing in the Senate. And they cover all kind of things. They cover things just about us. And then there's other legislation too. Like I have legislation called the Urban Progress, and it deals with, I'm a big gun violence prevention person. So it deals with that. It deals with police community relations, but it also deals with mental health in our communities, mental health and economic development. It's a more holistic, approach to gun violence prevention. But we just talked about this very thing today for about 5 hours.
Okay, great. I'm happy to hear that because integrated care is critical right now.
I have my master's in counseling too.
Oh, wonderful, wonderful. Okay, so we're in the same boat here. But primary care, mental health, addressing the family, bringing the family back, the fathers into the household, the community pulling together, that's the priority right now. That's where we're losing out. And justice is starting in the home. And I'm seeing it every day in my private practice and talking to my Black clients. We're breaking down. The family system and community is breaking down, and we need to address mental health as a priority. So thank you.
We had a young Black woman on. She's in high school, and one thing that she said that as adults, we need to listen to the young people. We need to be approachable and listen to their ideas and their stresses and their anxiety too. She was really Ariana Gross was her name. Connecticut. She was really good.
Congresswoman, in following up LaToya's question, let me ask this. If any of the legislation you mentioned passes, how do we assure that some of those resources and programs come into our communities and not deal with the disproportionate attention given other communities? I think that was part of what LaToya was raising.
Well, one thing that happened when we took over the majority, more CBC, 55 CBC members. So we're on the committees of jurisdiction, we're the chairs, and on approach, there's more of us. I mean, Barbara Lee's a champion, but Brenda Lawrence is on approach, Sanford Bishop, Bonnie Watson Coleman. So that helps shape, where the money goes. And believe me, there's nobody tougher than Barbara Lee. So we feel like we're in good hands in directing. And also the other thing is, if they didn't get it before, definitely more of our colleagues realize, at least in their conversation, we'll see if it's in their action, but it seems like it, that Black Lives Matter. When the police accountability bill went out, we had 231 people on the bill before we even voted on it, and we only need 218 to pass. We even had 3 Republicans on the bill, so I think people are finally getting what we're trying to say, but also we have the people in place, Maxine, financial services, Barbara, Bobby Scott, education. So we have people in the right places. There's a number of us on energy and commerce and financial services. So that all helps.
Congresswoman, I know you said you had a few minutes. So what we're going to do is we have 2 questions. Okay. We're gonna take those 2 questions first, really fast. The first one will come from Raquel Williams Jones, and then the next one will be from William Clyburn. So our team will just do both of those questions back to back, and then we'll let you answer and let you get back to our taking care of our business. So let's go to Raquel, and then we'll go to William right after Raquel.
Good afternoon. Well, good evening, everyone. Thank you for joining. Really quick, I wanted to ask what the temperament was in Congress, just leaving with a note that one of the things I believe, I run a national public housing tenants association here in Washington, D.C. called Can I Live? So we see firsthand public housing moms, single family head of households, the brunt of all that we talk about on this phone today. I also am a member of the Frederick Douglass Foundation. And I guess not only I want to know what the temperament is, but you can't legislate love. And so because you can't do that, I don't want to rely on a system that has not ever given us our fair due, and to continue in this particular climate that is so ripe for change, so ripe for that next phase, to continue to rely on a system that has never really done us well. So what is it that we are willing to do, those that are compassionate in their hearts, and those that have the wherewithal to create solutions outside of legislation? Because I shouldn't have to legislate that is illegal to put you in a chokehold, or is illegal to, hold one person that have resources over one that doesn't. What is it that we can do as a community to move beyond this thing that seems to be holding us hostage and holding us up?
Well, I understand what you're saying, but I think we need to be supportive of each other, like whether it's, supporting Black businesses. I mean, I think that's the big thing, that unfortunately, money is still, really important, and it still rules. But to me, we have to support each other in that way. But also, I just got off a phone call with my Illinois delegation, and we were talking about, police violence, but also we had community leaders on too, and they were sharing what they're doing to, keep kids off the block, keep kids in productive ways, so they don't get into the guns and the gangs and those kind of things. But I mean, I know we shouldn't have to legislate chokeholds and that kind of thing, but that is where we are now, and we got to legislate it so it doesn't continue to happen. But I know, you can't legislate heart or love, but I also think that there just needs to be more exposure and more experiences. So, people aren't afraid of each other, aren't afraid to speak up, and people are approachable, and people can make mistakes and around each other and be, corrected. But I don't think there's any easy answer, but I do think we need to, be supportive of each other. I'm on a website now where everyone's asking, where's the Black bakery? Where's the this? Where's the Black finance planner? Where's the Black realtor? So people really seem to be coming. Now that's in Chicago. People seem to really be coming together, trying to find out how we could support and uplift each other, because, when we do better, we do better.
Thank you, Congresswoman. We're going to have one more question. And William, I want to be mindful that, the Congresswoman, she is our shero, and she's a serious fighter for us all. But, we have to pick our battles wisely, and we want to choose our battleground. And for this particular call, our battleground, just for all of our participants, is healthcare. So if we can make sure that we take advantage of the Congresswoman's time with us, and let's focus on the battleground just for this next hour of healthcare. Not saying that every battleground is not important, but you do have to pick the battleground that you're going to fight on hour by hour. And right now we're going to fight on that healthcare background. So William, let's try to make sure our questions, and I respectfully would like to ask that we keep our questions focused on healthcare. Thank you. William. You got to come off mute, William.
Yeah, Elroy?
Yes,
yeah.
Sir.
Yeah, so thank you so much for what you all have put together. I've been taking notes from Reverend Sharpton to Dr. Blunt to Congresswoman Kelly. And my question is kind of interrelated. That task force, Congresswoman, how broad does it get? Because does it go into brownfields, which impacts the Black community? And does it go into what companies and corporations do, and everything from tobacco and how it impacts our lungs and our heart? Are you all going to be able to deal with all those issues?
You know what? It was just formed, and actually Yvette and I met Rep. Clark, but we will have our first meeting tomorrow. And these are people that, want to be on it, we didn't have to ask, people volunteered. So we're going to look at what the scope, like I said, I thought it was just going to be health, and he kind of widened us, but I might follow what your moderator just said, that we might just tackle, health first and see what we can do. But definitely we're going to look at, some of those issues. I don't know all the issues because we're going to, take input, but really it started because we don't want something like COVID-19 to happen again, to our community. We want to make sure we're more prepared and break down some of the walls and barriers and things like that. So I'll report back to you. You know how to find me.
Well, Congresswoman, you've been very gracious with your time, and we give you all the love, and we're going to keep you in our prayers. Just consider the Healthcare Equality Network your ally. Consider us your Braintrust, your foot soldiers. We are here to serve you and to help you get this football across the goal line. And this is the battle that we've chosen, and we're going to be in this fight with you until the end.
We just ask that you guys help us put the pressure, particularly on the Senate, because it's just so frustrating. We do all this work and then Mitch McConnell holds everything up. So who's ever in Kentucky, we need we need people to vote. That's the bottom line. And who's ever in South Carolina too. So thank you guys so much.
Thank you, Congresswoman.
Okay, take care.
Take care now. Well, we're very appreciative to have the Congresswoman on. We're going to now turn it over to Dr. Ben Chavis to give us his comments and his thoughts on where we are and where we're going with this coalition over the next few months.
Well, thank you again. Again, I'll be very brief. Look, I think we got a lot of work to do. I think the surprise medical billing is still, while it's impacted Black America, there's still a lot enough understanding of how we can challenge this phenomenon that's happening. So I think that we're going to not only be publishing more op-eds, more investigative journalism in our newspapers, but I think this particular coalition itself, I would like to see us focus on ways to put pressure on some of the members of Congress who are still riding the fence on this issue. I think we need a hit list where we can really put pressure on those to make some difference. And then the last thing I would say is that I really think that we need to reach out to our millennials. There's not enough volume of information about surprise medical billing on social media. We need to step up how we engage on social media. I have some suggestions, Elroy, about how we engage more young people, young African Americans and other persons of color who are out there leading this charge now with Black Lives Matter. I think that a lot of times when you see mass mobilizations, you want to make sure it's tied to some public policy areas where we can measure results of the mass mobilization that leads to social change, that leads to systemic change and legislative change. So that's all I have to say, that we're part of the coalition. I'm glad to be about it. I decided many years ago, not gonna say how many years, that whatever L. Sharpton stands up on, I'm gonna stand up on and with it.
Well, thanks a lot, Dr. Chavis. But Dr. Chavis, you mentioned that we need to engage the millennials and the young people and talk to that group out there that's leading the charge in the streets, as we speak. So I'm going to flip with that over to Dr. Malveaux, one of our young leaders on the phone who's understanding social media, and we're going to let Dr. Malveaux talk a little bit about her support of the coalition and all the work this young lady is doing with the young people out there in the streets. I think I saw Malveaux on TV the other day leading one of the youth movements. So thanks a lot, Dr. Malveaux, for your work.
Well, all right, thanks so much for including me in this August group, and everybody has just really done a great job. I like Mr. Clyburn sitting here taking notes. Ben, of course, we appreciate your leadership at NNPA, one of your columnists. And Reverend Sharpton, nobody has lied when they said you just tore it up. I think I might have sent you a text, but you exceeded every expectation. You really did a great job. So thank you again for your leadership. And Elroy, I ain't that young. Sharpton and I are about the same age, but I'll take that.
I'm just going off looks.
Thank you. I appreciate that. I fight old age just like I fight racism. Let me say a few things about this. We have been dealing with this health inequality as long as we've been in this country as Black people, and so there's nothing new except for COVID has literally shone a light on all the things that we already knew about. We know, as an example, that 20% of the CNA, certified nursing assistants, 21 or 22% are African American, 21 or 22% are Latina. These are folks who don't have PPP. They're going to work, they're reusing things. So all of this is hitting our community harder. These are folks who can't work at home. I think everybody on here can work at home except for these folks. As Linda mentioned earlier, public transit, disproportionately African Americans, especially African American men. The brother in Detroit who somebody spat on him and then he died from COVID. And we see this happening again and again and again, because while Black Lives Matter has provided us with a unique and wonderful movement and moment, there's some crazy mad white folks out there. So the sister who mentioned mental health, that's really important. But as Dr. King always said, the law cannot make you love me, but it can prevent you from lynching me. And so we have to keep that in mind. Bottom line here is economics. And there are three things that I lift up when I talk about healthcare. One is accessibility. Are there places for people to go? Here in Washington, D.C., there's only one hospital east of the river, and that hospital is in flux. Meanwhile, if you come over to Ward 2 or Ward 3, plenty of hospitals. So we've been closing centers in inner cities, and that becomes an issue because if you can't get there, you know, what can you do? There's no maternity ward east of the river in Washington, D.C. The other issue is affordability or assets. So I call it the 3 A's: access, assets, and attitude. In the asset case, African American median income is $41,000 a year compared to household income, compared to $70,000 a year for whites and $80,000 a year for Asians. Those are median incomes. So we're at, the ratio has not changed. This is what we're dealing with. If you think about, and our families tend to be slightly larger, so $41,000 for a larger family. So we have to pay attention to that too. Many people don't go, I don't know what I was watching earlier today where they were talking about people not coming to the hospital so late. Copay. I mean, their copays may be so high. And so this is why this legislation around hidden billing is so important, because people will go to the hospital, they don't know what the deal is. I took a fall about a month ago in my own house and should have driven up to Howard Hospital, but I didn't. The ambulance bill was $950 to go. I could walk to Howard Hospital. I couldn't walk with the cut on me, but you know, $950. Now, my insurance says they're not going to pay it. Yeah, they will. But in any case, that's become something of an issue. The attitude issue is also extremely important. How are Black patients treated when they go to the hospital? Do people assume things about them that give them unlikability of having affordable or reasonable care? Again, not to reference me, but I fell, I hit the back of my head, went to emergency room, was fairly well treated, but a friend came and she said, "Did they look at the back of your head?" Well, they looked at it, but there was a cut. There was still an open cut as they were about to discharge me. And then I'm editing myself because I will say something else, but y'all know I'm too civilized for that. The individual asked me, did I have my Medicare card? No, my Medicaid card.
Wow.
At which point, I mean, I use a bunch of words with them that I won't use with y'all. It was ridiculous. But again, it was just a Black woman, PJs on. She must be on Medicaid. So we just really need to pay attention to those 3 A's. And the whole notion of truth in billing is so important because more than
I'm on a Zoom call here. I'll call you in about 15 minutes.
Go bankrupt because of medical bills, unpaid medical bills. Black folks are getting harassed when they don't pay their bills, but they can also go bankrupt. And bankruptcy now is a correlate for unemployment. So the economic issues that underpin this are extremely important and we can't lose sight of them. I know, Elroy, you said we want to be narrow focused in terms of what we're dealing with, but health and economics are just inextricably intertwined, which maybe is why you have me on this group. So I just don't want us to lose sight of the fact that there's an affordability issue here that we really have to deal with, and not only an affordability, but a structural issue, and all of this stuff is connected. The structural issue of how race affects how we're treated, whether it's in a hospital, whether it's on the street, whether it's in employment, and we have to really deal with this. We can't make people love us, but we can certainly look at economic underpinnings, and we have a moment to do that now. We have a moment to look at the unequal economy and to figure out how we can generate better results for Black people. So thank you.
Thank you, Dr. Malveaux. It's very insightful. We're going to reach out to my good friend, Reverend Dean Nelson. As we all know, our community, we're very diverse. We focus on economics, we focus on healthcare, housing. We're diverse in our thought leadership. We're diverse in our ideology. And one of the things about Reverend Sharpton, I've always been so honored to just sit at his footstep and learn from him, is just to try to build the broadest coalition he could build. And this coalition is broad. We have center right and center left. And I'm going to turn it over to my brother, Reverend Nelson, with the Frederick Douglass Group to give his insights on our activities and the work he's doing and what more we need to do in this healthcare space. Reverend Nelson.
Thanks, Elroy, for the opportunity to be on. Say thank you to all of the panelists who have already spoken. It is a pleasure for me to be on with you guys, particularly discussing this important issue. A couple of things I would like to say. Number one is, as the chairman for the Frederick Douglass Foundation, our tagline is righteousness, justice, liberty, and virtue. I want to say to all of those who are on the call, we are highly committed, number one, to accountability. And I think that with some of the legislation that we together are working on and pushing, I think that we want to see high levels of accountability, particularly with insurance companies. Secondly, we are highly committed to Black progress. And while we are center right, 70% of Black Americans say that they are moderate or conservative. Sometimes the echo chamber and the media seeks to divide us. And I'm pleased to be on this call with Reverend Sharpton, with Ms. Malveaux and others, because we are fully committed to Black progress. Sometimes that may come through a process that is economic opportunity, and we believe in the free market system. But in all cases, the free market system, it's not a perfect system. And so I just say that from the forefront, saying to you, Elroy, thank you for the opportunity to join with our brothers and sisters to really find solutions. As I mentioned a little bit earlier, in terms of what Frederick Douglass Foundation is committed to and involved in, I also serve as the executive director of Human Coalition Action, which is one of the largest organizations of its kind. We serve over 100,000 Black and brown women every year through our women's clinics across the country. The Congresswoman had mentioned a little bit earlier about telemedicine, and that's one of the things that we, during this COVID-19 pandemic, we had to shut most of our women's clinics down, but we have served more women through our work at Human Coalition, through our telemedicine and our virtual clinics than we ever had. So sometimes, even though we have challenging situations like COVID-19, it does force us to kind of re-innovate with some of the approaches that we use. I just want to close my comments by saying, number one, we did join with you, Elroy, in having some of our leaders to write op-eds, really challenging some of the congressmen who maybe had not fully gotten the message with regard to the issue that we're dealing with. And we are happy to continue to work in a bipartisan fashion to hold officials accountable, as well as these insurance companies, as we move forward to really deal with some of the inequities that we see within our community. To Ms. Malveau's point, with some of the research that we have done over the last 2 years, and we have produced one policy report that challenged some practices at HHS. But one of the things that we have recognized throughout healthcare, that Black women in particular are not just dealing with these disparities, but often feel that they do not get good customer service when they go into many of these healthcare facilities or to doctors. And that's something that I do believe is important for us to address as we move forward. Lastly, I'm just grateful for the number of doctors, healthcare workers that are participating on our call today. I would love to continue to have this discussion with some of those leaders who are on, doctors I know from different states who have joined this call, and other people like Latoya, who mentioned some of her comments earlier. So thank you so much, Elroy, for the opportunity to be on. And we have a commitment from the Frederick Douglass Foundation to continue to work with you in a bipartisan fashion to see better outcomes for Black people in America. Thank you.
Thanks a lot, Reverend Nelson. And I just wanted to let Reverend Sharpton and the rest of our leadership team know you all would have been proud of Reverend Nelson. I had the opportunity to sit in a lunch meeting with him and four other folks with Vice President Pence about 2 weeks ago. And Reverend Nelson brought a very strong message on behalf of our community, and he articulated it very, very well. And Reverend Nelson, the Congresswoman, indicated that we needed to, our fight's going to be in the Senate. So we're, the Republicans are in control in the Senate. So Reverend Sharpton and Malveaux and I, we're going to be leaning on you, man, to help carry some of that water in the Senate. And thanks for getting those 3 votes we know you were key in getting those three votes to help out our CBC brothers there in the House on that most recent legislation that the Congresswoman talked about. So thank you for joining our effort.
I want to add to that. I think it's very important, Reverend Nelson, that you know that we're happy that you're part of this, and we do want to operate in a bipartisan way. We all have different roles and different roads, but we're headed the same place, and so we very much appreciate you being part of it. And as a show of solidarity, I have some old-fashioned healing oil next time you go see Vice President Pence. I want you to anoint Vice President Pence with my special oil. I'll get it to you.
Amen. Amen.
Thanks a lot, Rev. Our last, I think Mr. Charles Steele is on with the Southern Christian Leadership, or Kevin. Kevin, are you or Mr. Steele going to comment, or should we jump right into Q&A? I can see them on. I can only see their names, but I can't see faces, so I'm not sure if they're still with us. But the Southern Christian Leadership Conference is another ally in our effort here, and I'm assuming they've probably had to take a pause for a second.
Yeah,
so
he was on.
Yeah, he was on, but he's not here now. Looks like he may had. Oh, he had to sign off. I'm just getting a message. He had to sign off. So let's go. Either we can jump right into our Q&A from our doctors and healthcare groups around the country, or we can go to our media. It's about 6:58. Let's see if we have any questions from any of the audience here. Okay, so we're going to jump right to our press questions. So we have 2 questions from the press to talk about surprise medical billing and what we're doing with Congress to focus on that. The first one is Catherine Davis.
I am not with the media. I'm sorry. I clicked slowly, I guess.
Okay.
So that you had moved to the other question. I just wanted to know if you all are looking at examining existing policy and legislation as it relates to targeting Black women. Reverend Nelson just mentioned a report that Douglas Leadership Institute did, actually in conjunction with my organization, the Restoration Project. But we highlighted that inherent in some of the policies being promoted by the Office of Population Affairs is having a very detrimental impact on Black women. For example, Depo-Provera is very harmful to Black women, and it facilitates HIV. And as you know, we have a huge spike in the number of HIV cases among our youth. And that's a policy that HHS has been implementing for a very, very, very long time, that maybe this examining these kinds of policies can help facilitate some changes for, without having to do more legislation, we can fix the broken legislation that we have now. And I'm just wondering if you all have had any conversations about doing that kind of examination of existing policies that are so hurting our young women today.
Well, I'll kick that. Thank you, Catherine, for those comments. Truly appreciate it. I'll kick that right over to Linda Blunt.
Okay, thank you, Catherine. Yeah, you are so right. There's so much that's in place now that needs to be looked at. And I can answer, yes, we are. I mean, we have this wonderful partnership with the folks on this call, but also the Black Women's Health Imperative published Black Women Vote, a national health policy agenda in 2018, and we'll be re-releasing it and updating it for 2020 so that voters can understand what the key health issues are for Black women, what the key legislation is, and be informed when they're talking to candidates, and also use this, there's actually a scorecard in it, to hold elected officials accountable after they're elected. So it's a great tool, and you can get it on our website, bwhi.org, and download it to inform yourself on the key issues. But we will be expanding it for the generals for 2020. So in September, a new version and with even more issues will be released. So please use that and share it with your community and your organizational partners.
Thank you so much. I would encourage you also to go to the Douglas Leadership Institute site, and the report about Health and Human Services is there. And it outlines several areas where women are being hurt. So I would encourage you to take a look at that as well. Thank you so much. God bless you.
Thanks, Catherine. Our next person in the queue is Del Monte. Mr. Jefferson, go right ahead, sir.
Thank you very much. I appreciate the opportunity to be here, and thank you, this network, for this dynamic discussion that you're having and for the plans that you're putting forth. My question is, we know that the health inequities are directly related to racist policies, racist institutions, racist systems that have been in place in this country since its founding. And we can't deny that, both with COVID and the racial unrest that's been happening. Now, we can't dismantle and do anything about the racism unless we address capitalism, because we know that capitalism in of itself is what drives and leads us to these racist ideals and these policies. So when we get back to capitalism, how do we address capitalism and these corporations that have exploited African Americans and people of color since we've been brought to this country? We've got tobacco companies, for example, that they made us pick tobacco, then they made us become addicted to tobacco, and now this same tobacco is impacting our lungs, and then we put COVID on top of that. So that's just one example. So how do we address the capitalist institutions? We know we can't get rid of this capitalist system we live in, but we've got to do something to address this capitalism that's driving this racism.
Mr. Jefferson, thank you for that question. I'll take the first stab at it. You know, my father used to tell me the biggest coward in the world is capital. The biggest coward in the world is capital. If we make capital afraid, then it will flee. Now, what do I mean when I say that? You know, corporate America understands profit or they understand pressure. Two things corporate America understands. If you can make them money, they will work with you, or if you can apply pressure, they will work with you. One of the things that our organization we're going to do is we're going to hold them accountable. We're going to make the cost of the capital extremely expensive. And once you make the cost of the capital extremely expensive for corporations, then you get their ear. And once you get their ear, you can hold them accountable. So that's what the Healthcare Equality Network will be doing. We'll make the cost of capital expensive. We'll work with our various members of Congress to hold them accountable. And then we'll begin to address these surprise medical billing issues and other disparative issues in healthcare. That's from a strategic perspective. You know, I'm not the medical or expert here on the team, so I serve in more of a strategic role. So that's how we'll be driving this campaign strategically. But let me let any of our other folks that are more engaged in the healthcare side of it respond to that question as well.
Well, I'm not engaged in the healthcare side as much as I am to the economic side, and the brother is right on. We really have to talk about dismantling predatory capitalism and understand it's predatory. When somebody gets a medical bill that's hundreds of dollars when they expected a $40 copay, that's predatory capitalism. You're attempting to extract every penny of surplus value from an individual, and especially from Black individuals. And so we really have to begin to look at that. I know a lot of folks, my right-wing brothers and sisters, like that word capitalism. Elroy, I'm so happy to hear that your dad had better sense than you. But but you know, we really have to look at the way this system is built. I mean, Dr. King talked about how we thingify people. And so when people become less than human, then we can treat them any kind of way. We've seen nibbling away at the corners of it, but I find it highly ironic that in the middle of a COVID pandemic, our fearless, whatever he is, wants to talk about removing Obamacare. This is the only safety net that some people have. And so at this time to do that, it seems to be being cynically cruel to say, as more and more people are getting sick and dying, we will restrict your access to medical services, or we'll put you in the kind of economic jeopardy that may cause you to go bankrupt, making it more difficult for you to find a job later. Some people can't get a job because of their credit score, and that's discriminatory as well. So I think we do need to look at you know, our top of mind, of course, is health, but we do need to look at the ways that predatory capitalism allows the extracting of surplus value from individuals engaged with the healthcare system, and then especially for the low-wage workers in the healthcare system. CNAs make $15 an hour, certified nursing assistants. They're on the front line. They're disproportionately Black and brown women. So we have to look at that as well. And so I just think that the brother is right on in talking about predatory capitalism. It infects everything that exists in the system. Infects. It's like a disease. And it's a disease that the antidote for is better legislation, different taxation. How do we end up giving corporations all this money? Black-owned businesses couldn't get very much. Many were turned away. We're at risk of losing 40% of our Black-owned businesses because of COVID. 40% of our Black-owned businesses. And so there is work to do, but I think that we need to call capitalism out more frequently and more frontally.
But thanks a lot, Dr. Malvone. You know I got dropped on the right side of my head when I was younger, so don't blame me.
Is that what happened?
Yeah. So, well, we want to thank all of our panelists. We want to thank our leaders from each of your groups for joining us. We started a little late, so we gave ourselves a grace period of 7 minutes to run over. Reverend Sharpton, again, thank you for your leadership. We are so grateful. You know, if a Reverend Sharpton did not exist, that would be our prayer up to God to say, hey, create us a Reverend Sharpton, because we need you, Reverend Sharpton. We need Reverend Nelson. We need Linda Blunt. We need Dr. Chavis. We need Dr. Malveaux. We need Mr. Steele. We need Mr. Kimball. And we need all of our 50 leaders on this call. We're going to continue to hold the insurance companies accountable. Reverend Sharpton, I'm gonna let you close out with kind of your comments and, you know, what do you want to see from the group over the next few months? And then Reverend Sharpton, if you wouldn't mind closing us out in prayer. You know, we're all children of God here.
Let me thank you for the critical role you play, Elroy, in coordinating all of us, and you work tirelessly at it, and we appreciate it. And I think that this is our mandate, and I think that this is a time of maximum activism. So we need to use this season and period to really pull things that will really fundamentally change our lives, which is why we need to come across party lines and deal with these issues in a way that will lead to legislation. I was taught growing up in Operation Breadbasket that we deal with demonstration to legislation, then reconciliation. If we just demonstrate and never legislate, then we are not going to have permanent change. So that's why there's a lot of focus on that. And Ben Chavis and others have given their life to that. And I think that we need to deal with the economic part of it. I agree with Dr. Malveaux, who works closely with my mentor, Reverend Jackson. But even he said the problem with capitalism in our communities, we can't get the capital. And we get all of the predatory movements. So I think that we all can unite around, there's enough common ground that we can do things that lead to legislation. If we just deal with is in and of the common ground, because we all have common health disparities in our community, whether we're Republican, Democrat, or undecided. If we can deal from that common basis, I think we can make real change for our community, and that's why we're together. And I hope that we keep that in focus. Let us pray. Dear God, we thank you for the mind of unity, and as we seek to achieve it, we ask you to bless our endeavors, bless everyone that thought it not robbery to be part of this leadership circle, and bless those especially that take the time to participate and to be a part of hearing, learning, and being involved in this discussion. You gave us life, we did not choose it. You gave it to us as a gift. Many never got it, and many were cut short. So we have the responsibility to protect the lives you gave us and to protect it equally and fairly, because this is the gift of you, and we want to celebrate that gift in a way to show that we will protect it. Give us a committed mind, a committed heart, and give us a real fervent desire to persevere and make our mark as you blessed us at this time in history. These blessings we ask in your name and for thy sake. Amen.
Well, thanks a lot to everyone. You'll be hearing more from the Health Quality Equality Network. Again, our Twitter is health_equality. Facebook is Health Equality Network, and we've actually been going Facebook Live. I'm looking here where it says we've been recording live. We ask all of our 50 participants, each of you are leaders of this coalition, this campaign, so we ask you to tweet this week. We ask you if you want to send out op-eds, forward them on to our Facebook page or our website, or reach out to myself directly. We can get you more engaged, and we will keep you updated on activities as we go forward over the next 60 days or so, trying to ensure that we stick to our mandate. Primary mandate is keeping the insurance companies accountable as we make sure that we have quality health and reduce those disparities that impact our folks. So thank you all very much. Again, God bless, and everyone have a great evening. Thank you.
Good night.
Have a great night.